Every few weeks, we hear about a powerful breakthrough in the medical world, and we're going to learn about one now. Carl Goldman with you, City of Hope, our special show here on your hometown station. And for those listening, if you're driving right now and you pass by the next 7, 8, 9 cars, and there happens to be a female driving, the odds are that one of those females of the next 8 that you pass by will come down with breast cancer over some time in the future. And that's a unfortunate statistic out there, but there's so many now new therapies and so much hope in the future for breast cancer. And we've already seen breast cancer come a long way, and all cancers come a long way. We're going to learn about that today, and you're going to want to stick around because there's so many new great things on the horizon in terms of cancer. We're going to learn about that through some of our experts here from our friends at the City of Hope. We have Dr. Fekrazad here in the studio along with Tricia, Eugenio, who's the oncology program nurse over at City of Hope. And both of you, what's cool is both of you are here in Santa Clarita. City of Hope, of course, has their main campus at Duarte, doing so many incredible things on the research side. But now we're fortunate enough here in the Santa Clarita Valley to have our own City of Hope, not just a satellite here, but really a facility that has a lot of diverse services. And Trish, maybe you can mention what some of those are here in the Santa Clarita Valley.
Yes, thank you, Carl. First of all, I'm a Providence Holy Cross Oncology nurse navigator, actually, and I'm working out of the City of Hope Santa Clarita location here. Providence has a collaboration with City of Hope now. Most of the oncologists and myself, we all live here in Santa Clarita. Our kids go to school here in Santa Clarita, so we're very excited to have pretty much all of the oncology services that you might need here in Santa Clarita. We're right there across from City Hall. So we do have medical oncologists, radiation oncologists, surgical oncologists, and GYN oncologists, and myself here in the office in Santa Clarita. So we're very excited about that. We've been here about almost 2 years now, and urologist
Right.
also.
And Dr. Fekrazad, your specialty is what? And you're with City of Hope.
Yes, sir. I'm with City of Hope. Good morning. I am a hematologist and medical oncologist. My expertise in blood disorders and cancer patients. So I've been with City of Hope since 2014. Prior to that, I was at the University of New Mexico in Albuquerque for 8 years.
And what's cool is you practice in Santa Clarita, but you also live here in Santa
That's
Clarita.
right. Yes.
Right?
Yeah,
Both of you live here
Yes.
in Santa Clarita.
Yeah.
And raising a family, et cetera. So we started this show talking about the 1 in 8 and talking about some of the new things that are on the horizon. Just in the news a couple
2 days
days ago,
ago,
2
yeah.
days ago, was a report that women with a certain type of breast cancer, and it sounded like it was one of the more mainstream types
Right.
of breast cancer,
Right.
the most mainstream of the forms. They're finding now that 70% of those do not need chemotherapy. Why don't you dive into that a little bit? What does that mean?
Sure, certainly. So as you mentioned that breast cancer is extremely common. 1 out of 7 or 8 women get breast cancer. Nowadays, we know that the age of presentation is in the 60s and early 70s, but we have learned that it's a little bit shifting to younger age. We don't know the specific reason behind it, but we believe that the reason is the patient is exposed to a lot of hormones. Younger, during the 20s or 30s, they get exposed to the hormones, and hormones can increase the likelihood of getting breast cancer. People who get oral contraceptive pills or any other methods of contraception using the hormones, they are at a higher risk of getting breast cancer down the road, like 20 or 30 years from now. So what we have learned from the study that is called Taylor X, if you want to go and read about it, they call it Taylor X. They tested more than 10,000.
And how do you spell that? So for those...
It's like a Taylor, Tailor, and then X at the end.
So simply go to Google, type in Taylor X, and
Exactly.
you'll
breast
get
cancer, yeah.
you'll get a lot of misinformation too. So
Yeah.
make sure you go to the right sites, the legitimate sites on this to
Right.
get but we're going to give you the correct scoop right now from the
Exactly. We're
professionals.
going to give you the correct scoop of that. So,
Yeah.
so we basically simply divide the breast cancer in two categories. One we call it the hormone receptor positive, meaning that the patient has the estrogen receptor on the surface of the cancer cells, and the other one is either hormone receptor negative or HER2 positive, which is another marker on the surface of the cancer cells that we can detect. So majority of women, they get estrogen receptor positive cancer, which means that the estrogen as a hormone, female hormone, can stimulate the cancer cells to grow faster and they multiply. One becomes two, two becomes four, four becomes eight, etc. So when the patient is exposed to the estrogen or estrogen containing products, these cancer cells start to learn about, as I have food to grow, and now they start to divide. So the study was specifically on patients who have estrogen receptor positive breast cancer. It was not tested on patients who are estrogen receptor negative or HER2 positive. Only big pie of breast cancer, which is the estrogen receptor positive breast cancer, they were tested, more than 10,000 patients, and these patients have only local disease. I need to emphasize that this patient did not have metastatic disease. The disease did not go to the brain, to the bones, to the lung, etc. Was only limited to the breast, and even though the axillary lymph nodes or the lymph nodes under the armpit were negative. So let's specify.
And part of the reason for that is it was caught early.
It was
correct?
caught
Catching
early. It was
on.
caught early, and it was a good form of breast cancer to get.
Right.
So, the way that I tell my patients, I tell them that breast cancers or any cancers are like weeds in the backyard. We have different species of the weeds. It's not only one form of weeds that we get in our backyards. And this study, which was mainly tested more than 10,000 women with early stage breast cancer, estrogen receptor positive, with no evidence of metastasis to the lymph nodes or any other organs, they identified that the patients are categorized in 3 different categories. And the way that they tested this patient, they look at the 21 genes on the tumors profile, and they found that some patients have like a low grade, some have intermediate, and some have high grade form of this form of cancer. For patients who have estrogen receptor positive, no evidence of nodal metastases, and low Oncotype DX score. The score that we test, we call it Oncotype DX. That's another name, so nobody needs to remember that. But it's like having a blood sugar, testing the blood sugar. So if your blood sugar, for instance, the range is between 70 to 100, if you are falling in the 60 to 70s, you are falling in the low category. If you are falling in the 120 and plus, you are in the high category. And people in between are in the intermediate category. So the patients who are in the low grade category, they do not require to get chemotherapy.
So what are they getting in place of chemotherapy?
Perfect. In place, we give them hormonal treatments, which means that we give them treatments to block the receptors of the estrogens. And even though if you have estrogens in your body, it's not going to stimulate the receptor to make the cells replicate, basically. So we learn about that, and these patients do not require to get chemo. On the other hand, patients who have a high genomic profile of this test, they definitely require to get chemotherapy. But these subset of patients are less. So majority of patients, they fall in the first, low risk or intermediate category.
Right, and to put that in perspective, at least from the articles I've read, they're saying that 70 within the category of women who have breast cancer where it's still isolated within the breast. The report I read is saying that 70%, that's a big amount, 7 out of 10 do not need chemotherapy. That's gigantic.
This is gigantic. But again, we need to learn about the message that we give to the community and audiences. We are talking about a small pie of all breast cancers. Some patients diagnosed with advanced stage, the cancer spread to other organs. Some patients have lymph node metastases. The lymph nodes under the armpits has been involved. Some patients have estrogen receptor negative breast cancer. Some patients have estrogen receptor negative and HER2 positive. But if the patient has estrogen receptor positive, no evidence of nodal metastases, and low and some parts intermediate Oncotype DX score, they don't benefit from chemotherapy. Meaning that if you give them chemotherapy, the patient have the side effects, but no benefit in improving the survival of the patient.
Now, there are breast cancers in males as well, even though it's a much, much smaller percentage. What is the impact on this for males?
The same thing. If the male has breast cancer with the estrogen receptor positive, which can happen, is rare but can happen, and the lymph node is not involved, we check the Oncotype DX, and then we identify if the patient would benefit from chemo or not. But majority of male, they don't have the estrogen receptor on the surface of the cancer cells, that have a triple negative form of it.
Your hometown station, 98.1 FM, AM 1220. Carl Goldman with you. We're streaming live on the web at hometownstation.com. Of course, you can download our KHTS app. Go to your app store and type in KHTS Radio, and there we are. You can pull us up. Of course, Facebook, Twitter. We've got it all. We're coming in every possible way here on your hometown station. It's the City of Hope Hour, and we're talking with the experts right now, talking about the future of cancers. Also in the news in the last week or two is they've changed the age for males to go through their potential test for prostate cancer and lowered the age by 5 years. Are you guys aware of that? Of course you are.
Right.
What was the reasoning there, and what's the purpose of that?
So let's get back to the prostate cancer. So prostate cancer is more common than breast cancer.
Yes, so guys, you better be listening over the next few
Right.
minutes to this, because prostate cancer is definitely more of a male thing than a female thing, right?
You
By
mentioned about the cars that
Right.
people are.
Yeah.
So if 1 out of 4 men will get prostate cancer.
Holy cow. 1 out of 4. So
That's
as you're
right.
driving around right now, 4 cars passed you by,
Right. We are 4 men
and
in
there's
this
4
room.
men in this room right now. One of us is going to get it. That's a high percentage,
25%, right?
Yeah.
That's right. So, so prostate cancer is extremely common. But the message is, majority of patients die with the prostate cancer, not because of the prostate cancer. Even if you have it, it's not going to cause any problem for you. But obviously, the early detection and obviously knowing that this patient prostate cancer is not aggressive is the key. I just lost a patient, unfortunately, with advanced prostate cancer in early 50s. So, he was 51 years old. But his cancer started at the age of 45, and within 6 years, he passed away from aggressive form of breast cancer and prostate cancer.
My dad passed away on his 91st birthday of prostate cancer, and he had stubbornly refused to go to a doctor for many, many years, and he still got to he lived a great life up to 91 and didn't actually see a doctor till
Right.
about a month before he had the
Wow.
prostate cancer. And I'm not advocating not seeing a doctor, but again, had he gone in when it was at an earlier stage, he might have made it to 100. Hey, Burt Lancaster is 101 right now.
That's right.
And he could have done it maybe. But so they've lowered the age now by 5 years, correct?
Right. By 5 years, and
For getting the colonoscopy.
colonoscopy, and in terms of the PSA is debatable to check the PSA or not. U.S. Task Force does not recommend checking routine PSA on our patients, but if the patient is at high risk with a strong family history of prostate cancer, or the patient has symptoms from the prostate gland, we test them for this blood test. And colonoscopy is another test that we do. Colonoscopy is a test that we check the colon, the entire colon. As you know, the colon cancer is one of the most common cancers that we see in men and women. Lung cancer, breast and prostate cancer, and then colon cancer is right after them. So it's number 3 or 4 if you look at the statistics in terms of the colon cancer. The reason is we know that it takes about 10 years from a polyp to become the cancer. So if we do a colonoscopy, we identify the polyp, we can potentially remove it and prevent getting colon cancer. But how do we get polyps? Usually it depends on the food that we consume. It depends on whether or not we have constipation or not, because constipation can increase the likelihood of getting colonic polyps. And on the other side, people can have the genes to form the polyps in the colon. Polyps is the little extension of the mucosa of the colon that becomes abnormal. They start to grow, and then at the 5 to 6 year point from the initial formation, they get a mutation that the cells try to replicate and become colonic cancer.
And diet, as you just mentioned, has an impact on this. So some of the foods that I understand
Yes.
we should be eating are things like broccoli, flax
Fibers,
seeds, fiber, high fibers.
high fiber diet, low, meat and meat products, such as, red meat is not good. Vitamins, and fresh fruits, those things are good to prevent getting colon cancer. And sometimes even aspirin can help the individual not getting colon cancer because they stop the proliferation of the cells.
And then the age range has been dropped from 50, Tricia, maybe you can answer this too, from 50 to 45, is that correct, for
Yeah,
getting
so
colonoscopy?
I guess a takeaway, because it can be really confusing. It depends on where you're getting your information from nowadays. People just take any news on social media is real news. The takeaway is those are recommendations. I still
But
go
those
by the
recommendations
standard-
aren't coming from social media. Those
This-
recommendations are coming from
Correct, yeah.
from major entities, right?
Yeah, like the U.S. Task Force that
Right.
Dr. Fekrazad mentioned. It's still worth it to talk it over with your provider, because that provider is going to go over your family history. Like yesterday, I read something about the 23andMe is doing BRCA testing now, which is the breast cancer gene, and which predisposes you to breast cancer and ovarian cancer if you have that mutation. Now, 23andMe is very widespread. They do this direct-to-consumer advertising. Now, everyone's going to ask for that BRCA test, and then what are they going to do with the results? So before you go out there and ask for these extra testing, make sure you talk it over with a provider, like I mentioned previously, and you have access to a genetic counselor who will go over the pedigree, which is family history, whether that's the right test for you or not, and what to do about it after you get the results.
Tricia, you've been listening to us talk about that, and the fact that 1 out of 4 males are going to end up with prostate cancer, 1 out of 7 or 8 females will end up with breast cancer. You get the patient when they've learned about it. What are the questions they're asking you when they first learn about it? Let's start on the male side first with prostate cancer.
So on the male side, of course, they're going to try and get out of the screening and the digital rectal exam if they can. So I always tell them, your health is wealth. It takes only a few seconds to do these screening exam, and it's worth it, especially if you have a family history or if you have a poor diet. We all know about the SAD diet, standard American diet. We all know what we should and should not be eating, but do we follow it every day? We don't. So I just do a little bit of encouragement, simple blood tests, or as a quick digital rectal exam. Same thing with mammograms, just a quick test. It's still a very good tool. Once you think about the risk and benefits, it outweighs the risks. The benefits is
So
a whole lot greater.
you've enrolled that individual to take the test. Now they learn they have it. They have cancer. What's the next step? Are they coming to you with questions?
Yes, so this is where my nurse navigation hat comes in. I feel like such a tour guide sometimes. So I put them in touch with the right doctor. So, of course, they start with the urologist if it's the prostate patient, and they'll go over surgery with them once they've diagnosed with prostate cancer. After a biopsy is done, then we do have them see a medical oncologist or radiation oncologist to do that consultation, just to give them their options as far as treatment, if that's indicated for them. Sometimes surgery is all they need, or sometimes they don't need surgery. It's just watchful waiting or surveillance. Same thing with women. Once they've been diagnosed with a normality in their imaging, We connect them with the surgeon, and they'll go over their options. And after surgery, whether it's indicated to have this Oncotype DX testing done, they may not need chemotherapy if it's caught early. So that's where my role comes in. I help navigate them who to call first so they're not making multiple phone calls.
Cool information. For those of you who are Star Trek fans, we're going to talk about, you remember Doc, and he'd have that little device, and he'd just roll it over the person's body, wave it over it, and instantly diagnose what the situation was. And then with a push of the button, no surgery, it was just done. We're going to find out how close we are to the reality of Star Trek in a couple minutes on the City of Hope Hour, your hometown station, KHTS.
Daily Imprints is the premier one-stop shop for custom embroidery, screen printing, and promotional products in the Santa Clarita Valley. Owners Joe and Dana have provided KHTS with quality embroidered company shirts for over 3 years. If it's new business cards or promotional products you need to enhance your image, Daily Imprints is the choice for you. Located on Lyons Avenue, stop by or call today, 661-678-0508.
Men, are you feeling tired, stressed, or just don't have the energy you used to? Did you know this could be related to decreased testosterone levels? Luckily, there's a safe, effective solution. Weeder Prime helps support healthy testosterone levels with clinically tested key ingredients. Just 2 capsules of Weeder Prime each day can help change your mood, energy, focus, body fat, and lean muscle. Feel the way you felt 10, 20, even 30 years ago. Rediscover your Prime with Weeder Prime. To find a retailer near you, visit WeederPrime.com. That's WEIDER Prime.com.
Aloha, friends! Go check out Honu Coffee, home of the best cold brew coffee. What makes their coffee special is how their organic coffee beans are infused with nitrogen to create a smooth and delicious cup of coffee. You'll also find traditional bold coffees and island-inspired signature drinks. They're the perfect place to catch up with friends or just relax with your favorite cup of joe. Honu Coffee on Lyons and Walnut in Newhall. Stop by and say aloha.
City of Hope is a world leader in cancer research and treatment, and there's a City of Hope community practice location right here in Santa Clarita, eliminating a major barrier in the fight against cancer: distance to quality care. Santa Clarita benefits from City of Hope's compassionate care and renowned clinical expertise. Find out more at cityofhope.org/Santa Clarita or call 661-799-1999.
Hometown. Your hometown station.
I can change the world. I will be the sunlight in your universe.
KHTS, this beautiful June day here in Santa Clarita, 1229. Carl Goldman with you in the studio. It is the City of Hope Hour, talking with our specialists from City of Hope, and also from their friends and our friends at Providence Holy Cross. Nice marriage. And we're so lucky here in Santa Clarita because we have a really incredible group of medical institutions here and partnerships that are taking place. And this is one classic example of that with City of Hope, with their offices right opposite City Hall here in Valencia, Holy Cross down the hill,
Right.
where the 514 meet, and Providence also with a large group of different offices here in Santa Clarita as well, one right there on the intersection of McBean and Valencia Boulevard. And in fact, I've used that, and many of our friends have used both the Holy Cross hospital down below and the Providence facility up here. We have Dr. Fekrazad here in the studio, and also Tricia Eugenio. I got it right this time,
Yes,
right?
thank you.
Got it right with Tricia with Providence Holy Cross as an oncology program nurse, Navigator, and the doctor talking about the future of medicine, and we were really the profound impact talking about earlier, if you just tuned in, 1 out of every 4 males. So as you're driving around, just to put it in perspective, watching those cars pass by you, 3 cars with males driving, that 4th car is most likely going to have prostate cancer. For females, it's somewhere between 7 and 8. So as you're driving over there down past Valencia Boulevard right now, listening in, 1 out of every between 7 and 8 women will come down with breast cancer, and of course there are other cancers as well. I was chatting about and going back to Star Trek days where Doc Bones would have that device and just automatically, without needing any surgery, without needing any penetration of the skin,
Right.
scan the body and figure out what the problem was. We're not that far away from that, are we? Because we've
No.
come a long way since that first Star Trek came out in the late 70s, and they
Right.
came up with that idea. Medicine has come a long way
Oh, certainly.
since then, and we've got a lot of cool things on the horizon. Why don't you share some
Sure,
of that?
you know, you put a very good perspective. You know, when we go back to the 1970s and 80s, we were just talking about this a few minutes ago, that back then, number one, we did not have the tools to diagnose the patient, and number two, we did not have the tools to treat the patient appropriately. That's why then when you look at the data, approximately 70% of the patient with the diagnosis of cancer, they used to die back in 70s. And now, 2018, 70% of them will be saved from dying from the cancer. I mean, there's a huge perspective of changing in the paradigm
That's
of...
gigantic. That's worth repeating. So
Right.
So in the 1970s, and that's not that long ago.
Right.
We're talking, 50, less than 50 years, 40 years ago.
Right.
70% of the people diagnosed with cancer did not make
All
it.
comers, talking
Yeah,
about
of
like
all
brain
of it.
tumors,
Right.
lung cancer.
Fast
But
forward to today,
today,
and 70% are going to
make it.
survive
I mean,
this.
still we lose a lot of patients with cancer. But looking at patients with breast cancer, prostate cancer, lung cancer, brain tumor, now we have techniques to diagnose them early on. We have techniques to appropriately remove the cancer. Looking at the surgery tools that we have, neurosurgeons, brain surgeons are able to resect the tumor as much as they can without damaging the normal brain tissue, because they have the appropriate test to map the tumor and tumor area and remove not only the tumor but also the legs from the tumor. And breast cancer, the same thing. We diagnose them early, we remove the cancer, and unfortunately, sometimes, number one, the patients are not compliant with the recommendation by the providers to do the screening test, so they don't diagnose early on. And number two, sometimes the cancer is aggressive, so it comes like a soil and seed. If you are dealing with a cancer which is aggressive, even you try to tackle it in early on, you're not able to do that because you get defeated. It's very aggressive. The cancer cells tend to divide rather quickly. I remember that I saw a patient like 4 years ago in the hospital. He was in his 40s, very young man. He had a lymph node in his neck. It was about the size of a small golf ball. In the morning when I saw it, it was the size of a small melon, within less than 12 hours. So we biopsied, and it came back a form of cancer that tends to divide within hours, not within days or months. So it happens in HIV patients, and we call it Burkitt's lymphoma. But it is a typical case of cancer dividing within hours. Like from 1 centimeter becomes 2, 2 becomes 4, 4 becomes 8 centimeter within hours. So this is how we diagnose. So if this patient was back in 70s, from the time that the patient was identified to have this tumor, seeing a provider, driving from one location to another location, getting a sample, the patient would be dead. But that particular individual, got samples. It was back in New Mexico, diagnosed with, form of non-Hodgkin lymphoma, because Burkitt's lymphoma, got treatments, and he's cured now. So this tells us that how important it is to diagnose the patient as early as possible and appropriately treat them. So, but going back to what's going to happen in the future, because we're always looking forward to improving our, number one, quality of care and improving the outcomes of the patients. So now we have learned that we can sequence the gene of the cancer, and we can sequence the individual's gene. For instance, the individual who is in his 40s or 50s, we can sequence their gene and tell this particular person, yes, in 10 years you're going to get this cancer. in 15 years, you're prone to get this cancer. We can find out about this information. This information is very useful, but it can be detrimental to the individual's life because it can cause a lot of anxiety associated with it, you know. And sometimes we do these tests, and later on we learn that it was not appropriate to deliver aggressive, intensive approach because these patients, God forbid, had a heart attack and died from
From the
you know,
anxiety. Or
from
other-
the anxiety,
Right,
or
yeah.
having the diabetes, or cholesterol issues or hypertension. So the way that we learn it, we are able to learn how to balance, have this information but use it in appropriate manner to prevent getting dilemma and poor outcomes. So this we are learning as we mature in this field, and we have done a lot of basic science in the last 5 to 10 years, and this data is emerging as we moving forward. But now we are pinpointing of who to test, when to test, and how to interpret the tests. Because I just mentioned that not long time ago, a few weeks ago, I saw a patient in her 40s. She has breast cancer. She's a patient of mine, and we check her for BRCA or BRCA gene, which is happen in individual who get breast cancer, male and females. And this individual did not have this gene, but her daughter's pediatricians tested her 13-year-old daughter, and it came back positive for having this BRCA mutation. So obviously we don't recommend to test the individual at that young age because, number one, patients don't get breast cancer in the teens. They get it in the 30s and 40s. And now this girl who has this information that you have prone to get breast cancer, she's very emotionally disturbed. Performance status, performance at school decline. She's not doing well. So obviously it was tested in a wrong time. It would be tested later on, but it was tested in the wrong time. So we are maturing ourselves, or as we learn about these tests and as we learn about these tools that we have. But going back to the future, I am very optimistic that in 5 to 10 years, we have more targeted therapy. The targeted therapy means that we identify the gene or we identify a receptor on the surface of the cancer cells, and the treatments only attack those cells or those area of the body who has these abnormalities. And obviously it's very impressive to have this targeted therapy because they don't damage the normal cells.
And I know City of Hope over in your Duarte campus, you're doing a lot of research,
right,
specifically focused on that.
Yes, that is one of the newest methods that we have. We call it CAR T cells, CAR and T. CAR T cells is a new modalities of treatment for patients with advanced cancers. The way that we identify the T cells, which are a part of our white blood cells, which is the immune part of our human body. We engineer these T cells and we teach them to go and attack the cancer cells. We find a mutation or an antigen on the surface of the cancer cells. We tell these soldiers to identify these abnormalities on the cells that they have and target those cells. The way that I see it, is like training an FBI team to go and attack only the bad guys. And they are able to identify those cells because they have the specific markers on the surface of the cells. And these engineered T cells, they go and attack these cancer cells. So it's a dramatic improvement in the cancer treatments. It started from City of Hope as a first first institutions in the country, and they have had great success in that regard.
And I suspect if we go to Google and type in CAR T cells, we can get a lot of information on it and see what's on the horizon as well. Tricia, we were talking about understanding cancers and understanding our bodies, because one of the things that I think could be the best steps for any of us to take, even talking about all this stuff in the future, is we know as individuals if something's a little off tilt with our bodies. Usually we know that long before it becomes an issue. Maybe you can elaborate on that a little bit and talk about how all of us could be more sensitive to what our body is telling us so that we could be proactive enough to step in and say, something's not right, I should come in and check it out.
Yes, so I highly recommend doing annual physical checkups and making notes. So for those days that you don't feel quite right, you feel a lump that hasn't gone away, a painless nodule somewhere that's been there for a while. It's not an acne, it's not a cyst. It's really hard. It's something that you might want to show your doctor or call your doctor. So those little things. And sometimes if you feel like you've been off for months now and you can't quite figure it out, it's not the allergies, it's not the flu. That's something that you really have to talk to your doctor about. And then just normal, common sense self-care. The body heals at rest, so we all need to get our 7 or 8 hours of sleep at night. A lot of us tend to abuse that simple fact, but that's that's the only time our bodies get to rest. We have to deal with so much stress during the day. I mean, just watching the news first thing in the morning stresses me out. So sometimes I go on news fasting as a sort of a self-care. So that even going for a walk, being out in the sun is a natural healer that keeps your head clear and makes you a little bit happy without taking any other stimulant. So those kind of things.
And
Proper
obviously
diet.
exercising and diet we've talked about.
Exercising is very big, even in the cancer world. There's a big study on breast cancer women. I forget how many thousands of breast cancer women that they followed after treatment, and they found that 150 minutes a week of moderate exercise help prevent recurrence. So that's a big deal. So you don't have to take a pill, and you don't have to take any magic pill to prevent your cancer from coming back. All you have to do is walk 30 minutes a day for 5 days a week. And with that, you get the added benefit of social interaction if you're walking with someone or walking your dog. So you get that special bonding with your little friend. And you don't have to take medication. So just those little tidbits, it just helps.
There's also a certain percentage of us listening who just are afraid to meet something head on or afraid of the unknown and have a lot of anxiety about even going to the doctor. How do you encourage those individuals who are hesitant about doing it and have this fear to begin with? How do you get them over the hurdle?
Right. So there are people like me, especially if you think there's something seriously wrong with your health, you can always call a nurse and talk to someone. Even insurance companies now have patient navigators or a nurse hotline that you can talk to. There's a big stigma, especially in the cancer world, once they hear cancer. There's a big stigma with chemotherapy. People are afraid of it. The exciting news for providers like us, there are a lot of medications now that would not make you sick if you have to undergo chemotherapy. I remember 20 years ago when I used to give chemo, I can time when the patient will throw up after I've given the chemotherapy. And that's not the case anymore. If you do have sickness, that's outside of the norm after you've had chemo, because we can prevent those kind of things. So there are nurse hotlines now that you can call through your insurance companies if you have just a general health concern and you can't quite pinpoint what to do about it if you're afraid to go to the doctor.
And there's also our best friend Google who can help, but be careful out there because there's so much misinformation, particularly on the medical side. I want to just have a flashing alarm here that if you think you have symptoms and you go to Google, go to a site that is reliable and going to give you some good basic information. The National Institute of Health, we know, is a good site. WebMD is another good site. The cityofhope.org itself has a lot of good basic information, as does Providence and the
Correct.
Providence site.
Yeah.
But I really encourage you to make sure when you look at all the information out there, particularly on the social media side, but even a lot of sites that look like they're good information sites can give out a lot of garbage on the medical side, right,
That's
Doc?
Right,
That's very true.
they're driven by companies. There's also eatright.org. That's where my dietitian friends refer their patients to go to.
So eatright.org.
eatright.org.
I
Yes,
haven't
so
checked
it's just
that.
general diet questions and what to eat, what not to eat. If you're on a low salt or if you want to go high fiber, just options. It gives you a lot of options based on the kind of foods that you like to eat.
But if someone is experiencing symptoms, X symptoms or Y symptoms, and they go to Google with those symptoms, other than WebMD and the National Institute of Health site, and of course the Providence and City of Hope site, any
there's
others
another-
that
another
are good ones?
website. They call it e-medicine.
E-medicine?
Like electronic medicine, e-medicine. It's a good website, and it has a lot of information.
Is that emedicine.org?
Yeah, I think .org
Dot
or
org.
.com. .com.
Okay.
And the other website is Up to Date. That's also a very good search engine, which is, as you mentioned, is very reliable, extremely reliable. And majority of physicians, they use that website to teach their patients about what is considered up to date for.
There's new information for me. So Up to Date
Yes.
is the website,
Yes.
and eMedicine, a couple sites to check out. And you know, as medicine is improving, so of course is the internet and the information out there as well. We're going to talk a little further about City of Hope. Talk about, before we end the hour, I want to talk about a couple of new breakthroughs as well with our friends here from the City of Hope and also from Providence Holy Cross. We're going to take a short break. Your hometown station, KHTS.
Comfort Keepers provides your loved one with loving in-home care.
Miles McNamara, certified senior advisor and owner of Comfort Keepers in-home care.
Our caregivers can help you in your own home, enhancing independence, creating safety and comfort. Our Comfort Keepers provide companionship, meal preparation, medication reminders, assistance with personal care, and even transportation to doctor's appointments. If someone you love can use a helping hand at home, visit comfortkeepers.com.
Or call 287-4200.
If you're tired of your nail polish chipping a day or two after an expensive manicure, then you'll love the gel nail polish manicure now offered by Ann. Ann is a licensed manicurist serving the Santa Clarita Valley in Canyon Country for over 15 years. And now she's offering the gel manicure that lasts without chipping for up to 2 weeks. Log on to hometownstation.com for details on how to get an amazing deal on gel nails by Ann on Restaurant Row, or call Ann at 250-8340.
The Santa Clarita Artists Association has a new gallery in downtown Newhall on 6th Street between Main and Railroad, right across from the Canyon Theater Guild. The gallery features our members' paintings, sculptures, and one-of-a-kind handcrafted gift items. Whether you're an art lover, buyer, or an artist wishing to join, visit our website at santaclaritaartist.org, come to our free monthly meetings at Barnes & Noble, or stop by the gallery. For upcoming events and exhibits, check us out at santaclaritaartist.org. We make visual art visible.
Time in Rio brings their musical magic to the Santa Clarita Performing Arts Center on Saturday, June 30th. KHTS is proud to present Diamond Rio, 6-time Country Vocal Group of the Year, 23 top 10 hits. Experience Grammy Award winners Diamond Rio like you've never seen them before, right here in our hometown at the Santa Clarita Performing Arts Center. Country legends Diamond Rio, and featuring our one and only local singing sensation, Savannah Burrows. Savannah Burrows and Diamond Rio, together at the Santa Clarita Performing Arts Center, Saturday, June 30th.
One more day.
Tickets are going fast. Visit canyonspac.com to purchase yours. canyonspac.com for Diamond Rio.
Men, are you feeling tired, stressed, or just don't have the energy you used to? Did you know this could be related to decreased testosterone levels? Luckily, there's a safe, effective solution. Weeder Prime helps support healthy testosterone levels with clinically tested key ingredients. Just 2 capsules of Weeder Prime each day can help change your mood, energy, focus, body fat, and lean muscle. Feel the way you felt 10, 20, even 30 years ago. Rediscover your Prime with Weeder Prime. To find a retailer near you, visit WeederPrime.com. That's WEIDER Prime.com.
Your hometown station.
I can change the world.
KHTS 98.1 FM, AM 1220. Carl Goldman with you. It's the City of Hope Hour, talking with our friends from the City of Hope and their partners with the Providence group as well. We have Dr. Fekrazad here in the studio along with Tricia, Eugenio, and they are here talking about the future of cancer prevention. If you just are tuning in, we chatted earlier how 1 out of every 4 males, you're driving by right now, 3 males go by, the 4th one, chances are they're going to get prostate cancer and hopefully get it early and have it prevented. If you're a female, the odds are between 7 and 8 women will get breast cancer. More and more therapies coming online. A lot of prevention. We chatted about how in the 70s, 70% of cancer victims did not make it, and nowadays that number is reversed, where 70% of cancer victims are going to make it through. And there's some really incredible things on the horizon. We've been talking about some of those, but I'd really like, Doc, for you to talk about future therapy with immunotherapy that you already are doing here with the City of Hope here in Santa Clarita.
Right.
What is immunotherapy?
So immunotherapy, it comes from the immune system. Basically, what we have nowadays, we can accentuate the function of the individual's immune system to target the cancer cells. So it's not like giving poisons of chemotherapy, because basically chemotherapy that we offer to our patients, they are poisons to kill the cancer cells, but in a low dose poisons to kill the cancer cells. But the problem with these poisons, they can damage the individual's body. They can damage the kidneys, they can damage the heart, etc. But the immunotherapy is something new that we have learned and invented in the last few years. It's very recently approved for a new form of cancer treatments. But basically, we accentuate the function of the immune system to go and target the cancer cells. So it's approved for kidney cancers, it's approved for lung cancers, it's approved for colon cancer in some patients, liver cancer. It's very new. But as we learn, melanoma as well. So we learned that this immune system can sometimes cause problems. It's like any other medication. If you look at the brochure of aspirin, for instance, there are hundreds of side effects that can happen. So it's not without any potential adverse events, sure. So sometimes these immune system cells, they go and attack the normal cells because they are very angry. They are targeted to go to kill the cancer cells, but since they are angry, they call the cells that is sitting next to the cancer cells. So it can damage the lungs, it can damage the thyroid gland, damage the kidney or liver, but it's extremely rare. It's less than 5% of the time can have serious side effects. The majority of the time have mild or moderate. I just saw a patient earlier today with a kidney cancer. She had stage 4 cancer of the kidney, spread to other organs. We gave her immunotherapy, and we cannot find any cancer cells in her body. We got a CAT scan recently. There's no cancer cells. So these immune modulating treatments are able to eradicate the cancer cells that it was seen in the liver and other organs.
So 95% of the patients who are receiving the therapy are not seeing serious side effects.
Very
so those are good
tolerated.
odds.
Yeah.
And then what percent approximately are actually seeing cures from it?
So
I know it's got to vary, but if you just take a snapshot.
A snapshot. So back in 70s and 80s, let's go back, we did not have any treatments for a particular disease. We call it advanced melanoma, when the cancer goes to other organs. In the 80s, we learned that there is a high dose interleukin-2 can have a response rate about 10% for cure. And then in the late 90s and early 2000, the response rate with the new treatment became to about 40%. And now we have a combination of 2 treatments for melanoma, which can be given to a patient with a BRAF mutation, and the response rate in the 60% range. And it means that if you find the right person and give the right treatments for melanoma, even if it's spread to the lungs, liver, and you can cure them. But the problem is sometimes the cure is a very hard word to use, and this disease can go to the complete remission for a while, and disease can come back again. But still, we can give them some benefit of have no disease for a good while, of no evidence of disease for this patient population, which is dramatic. Patients who used to die within months, now they live for years, and eventually hoping that new treatments come to the market and we can control them.
And we'll see the Star Trek era come into place and continue to come into place. But so much is accelerating in terms of treatments. And I know when we come back and have you back, Doc, we'll have new things to talk about that are on the horizon. Tricia, also new therapies. And thank you so much for being part of this. cityofhope.org. I encourage all of you to go take a look at their website. But of course, we are so lucky here in Santa Clarita to have City of Hope here in Santa Clarita, right opposite City Hall. Go take a look at that. I learned 2 new sites. When we actually 3 sites I'm going to check before I do my next thing, and that's eatright.org, eMedicine, and Up to Date, as well as, of course, WebMD. Carl Goldman here with you on your hometown station. We encourage you to tune in again as we have City of Hope join us again next month, and we'll check out more information from the City of Hope. Your hometown station, AM 1220 KHTS.